Anniversary of the Affordable Care Act becoming law, North Carolina took a major step today impacting health care for more than 500 million people.
The General Assembly actually passed a bill that expands Medicaid coverage after years of Republicans opposing that idea. Capitol reporter Michael Hyland is live in Raleigh for us tonight. Michael, this has been one of the governor's biggest priorities.
Yeah, he said he's looking forward to signing this soon. There are people who've been advocating for this, saying this is going to save lives, but there are still some opponents of this who are concerned about the long-term cost.
For Democrats, it was a moment they'd waited to see for a decade. On Thursday, the House took the final vote on a bill expanding Medicaid coverage, making North Carolina the 40th state to approve it. Democratic Representative Pricey Harrison was in Washington for the signing of the Affordable Care Act 13 years ago today.
It's huge for North Carolina because we know what the benefits of this are going to be. 600,000 North Carolinians are going to have access to health care. It saves thousands of lives annually because of access to preventative health care and the jobs that are created.
Michael Morgan is one of the people who's pushed for this. After a cancer diagnosis, he said qualifying for Medicaid saved his life.
The hard work has come to a head, which is finally something that we've been working for a long time.
Under the bill, people who have too much money to qualify for Medicaid but not enough to afford insurance would gain coverage. The state will also receive a bonus of about $1.8 billion, much of which Governor Roy Cooper has proposed using for mental health programs. It also makes some reforms to health care regulations impacting hospital competition that Republicans have wanted. But Republicans also made expansion conditional on the state budget passing.
Just like with any budget, there'll be things that people like, things that people don't like, and I hate to really tie it in with the budget.
For Republican legislattive leaders, it marked a major reversal after opposing Medicaid expansion for years. Mitch Kokai at the conservative John Locke Foundation says he remains concerned.
As costly as Medicaid is, I think this could be a long-term punch in the gut for fiscal stability and long-term sustainability of the government in North Carolina.
A group representing the state's hospitals says this will especially help with keeping rural hospitals open. House Republicans are going to unveil their budget proposal next week on Wednesday, which will include Medicaid expansion. They think they will get a finalized budget to the governor by the end of June. Live in Raleigh, Michael Hyland, CBS 17 News.
All right, Michael, thank you.